Okay, so first we're going to go over oxygenation. This is a pulse oximeter. What you want to do is try to use the 3 fingers, not the pinky and not the thumb, and place it on the patient's finger, and then you're going to turn it on. And most pulse oximeters will give you the oxygen saturation level and a pulse. The oxygen saturation, also known as O2 sat, is measuring the amount of oxygen in the arterial blood system. So this is showing hers 96%. The range for normal oxygenation is 96 to 100%. And then her heart rate is 84. Now, seeing her nail polish reminds me that if you have a patient with very, very thick nail polish, it may or may not read the oxygen level. If that happens, most units will have a little alcohol, nail polish remover pad that you can take it off just one of those fingers in order to read the oxygen level. Now, typically with pulse and respirations, you're going to measure those back to back. You don't want to let a patient know that you are measuring respirations, because it could speed up or slow down the respirations because they become kind of more aware of what you're doing. With your pulse, you're actually using a technique called palpation. You're going to use your index finger and your middle finger. You're going to actually be measuring this right here. This pulse right here, the radial pulse. You do not want to press down so hard that you're actually feeling, you can start feeling your own pulse, but you want to press down just enough that you actually feel the pulsation. You're going to count, and this is where you have to have a watch with a second hand when you're first learning how to count pulse and respirations. You're going to count for 30 seconds and then multiply by 2 to get your rate in a 60-second or 1 minute period. After you count the pulse, from this point you can actually keep your hands there and measure the patient's respirations by observing them taking 1 full inspiration in and 1 full expiration out. That's considered 1 respiratory cycle. So you just kind of watch them. Again, you don't want to let them know you're watching because they might. You want to see them breathe in their normal rate and rhythm. And then you will also count those respirations for 30 seconds and multiply that by 2 to get your full. With your pulse rate, a typical normal adult pulse range is anywhere from 60 to 100 beats per minute. You will also see it written BPM, beats per minute. Now, you'll learn in pediatrics that level can be elevated over 100 because usually, specifically infants will have a heart rate that's higher. They also will have a respiratory rate that's higher. With athletes, sometimes you'll see heart rates below 60. If when you're measuring respirations you have a hard time because the patients are breathing shallow, while you still have your fingers right there, you can actually put your hand on their shoulder and feel them breathe in and out and count that way. That's kind of the last way you want to do it. You really want to try to watch, but again, if you cannot, you can put your hand there and feel the rise. Okay. So with temperature, if you have a Dynamap that it's actually on, you put it in the cover and you push down till you hear it click. So you're going to have to put it on the patient's tongue, make sure that they close their mouth, and it will beep 97.5. And you just hit the top of this to release the cover into the trash can. With temperature, you will hear a level 98.6 as your normal temp for oral. There are other ways to take a temperature: rectal, tympanic, which would be in the ear, temporal. Typically, another way, is axillary. So with your axillary temperature, that's typically a degree lower. your rectal temperature and your tympanic are typically a degree higher. Sometimes you will actually see, especially in pediatrics, this type of thermometer where you just take it out and put it up under the tongue. It actually has these little dots, and wherever the dot highlights last, that is your temperature. You'll see those used a lot in pediatrics. Temporal is typically a normal lower reading, usually around 96.4, so a couple degrees lower. So now you've probably noticed when you go anywhere, you have to have your temperature taken with a laser type thermometer, and we'll be checking your temperature when you come in. That may be used in facilities now just because it's a non-contact type of thermometer. All right, with blood pressure, we teach our students how to do something called a two-step blood pressure. When you validate, you're going to show us that you know how to palpate a brachial artery. In validations, we may be actually taking blood pressures on our mannequins. The reason we do teach the two-step is that if you have a patient maybe that has a low blood pressure, or you're out in the field somewhere and you don't have a blood pressure cuff, that you could actually possibly even just palpate a brachial artery to see what their circulatory issue is. So with your two-step, you're going to palpate the brachial artery. So remember earlier with pulse, we palpated our radial artery. Your radial artery is on the side of your thumb. Your brachial artery, if you follow the pinky all the way up, your antecubital space is right here. So you're going to palpate just above the antecubital space. Again, follow the pinky up, and you're going to palpate the brachial artery. Now, sometimes it takes just a little moving over. Some women actually will have a little fat pad, and sometimes typically that brachial artery is just over. Once you palpate that brachial artery, you're actually going to apply the cuff. And when we have our lecture, we'll talk a little more about cuffs. You have to measure the cuff to make sure that your cuff is not too large and not too small, because it can give you false readings. It could either give you a false low blood pressure reading or a false high. So typically what you want to do is to take the cuff on the width and make sure it's about 50% of the total circumference of the arm. So typically when you measure it, it should go from about halfway over to the halfway point, and see that's about 40% to 50% of your circumference. The length of the cuff is going to be about 80% around. Now, you want to come just above the antecubital space. It will tell you on the cuff where to line up your brachial artery. This is probably one of the things you'll have to try over and over. You will have a cuff and a sphygmomanometer, which this is your sphygmomanometer. It shows the numbers. And practice with that. Yours at home will actually have a little small sphygmomanometer that will fit right here. You have to get this snug enough that when you pull down, it does not fall down. If your cuff does that, you do not have it tight enough. So you just kind of have to practice getting it to where it's good and snug, but again, not too tight that it's cutting off your circulation. So first thing you're going to do before you ever put your stethoscope, you're going to palpate again that brachial artery. And I'm going to pump up, and you have to, if you're right-handed and holding the bulb in your right hand, if you turn the knob towards you, that's letting air out. if you turn the knob toward the patient, you do it to where it's just snug. Don't turn it so tight that then you're not able to actually open it up. If you were left-handed and holding it with the knob on this side, it's the complete opposite. So again, I'm going to palpate my brachial artery, turn toward the patient just enough that it stops. I'm going to start pumping up, and I still can palpate the brachial artery. And if you notice, the needle is going up on the sphygmomanometer. And I'm actually going to start releasing that very slowly. And when I feel that brachial artery stop, I don't feel the pulsation anymore. I'm going to say that's around 116 that I felt that brachial artery stop. I'm going to add 30 to that. So 116 plus 30 is 146. So I'm going to actually pump this up to around 146 to get in the range of where her systolic should be. So that's considered a two-step because you're actually palpating the brachial artery, then I'm palpating to get an idea. I add 30, and then I'm going to take with my stethoscope. The smaller part is your bell. The larger is your diaphragm. Now, some people will put the stethoscope in their ears and think I can't hear anything. You actually can turn. So you want to turn and very gently touch whatever side you're going to listen to. The bell is used in pediatric patients, people that have heart murmurs. Your diaphragm is typically the side you use for most blood pressures. So again, you just want to very lightly tap. It's very sensitive. I'm going to put it over my brachial artery. Again, I'm going to turn this knob toward the patient and stop right when I feel it get snug. Again, I'm pumping up to around 146. And very slowly release. When you hear that first consistent beat start, that is your systolic. When it stops, that's your diastolic. So her blood pressure actually was 102/64. Another thing you want to make sure when you're taking a patient's blood pressure is that their feet are uncrossed, because that can make a false high blood pressure as well. So with the numbers on the sphygmomanometer, again, I'm going to pump it up here so you can see. So what I did, I knew I was going to have to pump up around 146. And then you slowly start releasing. You will not hear any sounds consistently until you start releasing. If you do start hearing consistent heart sounds right when you start releasing, then you would have to release all the air out. Make sure all the air comes out of the cuff, and I would recheck it again and go a little bit higher, because that means that systolic was right at the point of where you started releasing. Blood pressure, we say 120/80. However, there's some patients that normals are around 110/70. 130/90 is kind of getting to the point where they say that's kind of maybe a pre-hypertensive state. The American Heart Association actually now says 140/100 or higher would usually be somebody that typically would be treated for hypertension. But again, with all patient conditions, each patient is individualized, so they just typically say 120/80 is kind of our normal range that we start looking for patients to have a normal blood pressure.